All right, thank you to both of you. So community organizing looks different in different places. It's in neighborhoods, it's in congregations, but I think the grounding that both of these presentations spoke to is it's really about bringing people together to build relationships to change the conditions that they live in. And both of you talked about how it's less about the outcomes. The outcomes really matter, but the process is as important. And that moving people to see what the 12-year-old said, I don't have to accept the situation, is a lifelong change that has impacts in every experience going forward for those people. The other thing that I heard was the questions of who decides, who asks the questions, who's at the center, and what's the racial analysis are key to building equitable processes that draw people in and actually create a co-owned, co-creative space to advocate for change. And the last thing I heard from both presentations is that even if you're aiming for one outcome, the snowball impacts that these projects have are huge and deeply impact the health and lives of people in these communities. So with that, I'll open it up to the room for questions. Okay, the mic will be at the stand over there.
Hello. I have one quick question, and so the point you make about integration, it's very interesting. Bell Hooks actually speaks about the same thing in terms of saying that integration might have hurt people of color in the United States more than it helped us. And then Stokely Carmichael talks about how integration usually only flows one way. And so if our goal is inclusion, then we need to make a new goal. So I guess my question is around integration and sort of defining a new narrative, when historically the narrative has not necessarily just been about whiteness, but it's been about access. And so some of the reasons we wanted to integrate is because, like, what these folks have over here, we're not allowed to have over here, so maybe if we integrate, we'll have access to those things. How do you sort of change the narrative when in a lot of ways it's still about access, especially if we look at structural racism, if we look at structural classism and those types of things, it's still about access.
Yeah. I think it's about addressing exactly what you just said. I think that in any place that we walk into with decision makers, particularly those around housing. So this work doesn't just sit in kind of education in Isaiah. It's kind of across the board. And so if we do talk to people around housing, it is about access to power. It is access to opportunity. So in Minneapolis, for instance, the North Side is considered, that's where all the people of color live. So part of the conversation is, well, it's okay that they are there. They want to actually live together, but what are the, how do we create policies, or how do we create infrastructures where they're not cut off? And then get into the hard questions of why are they cut off? What is it that's happening to the systems, whether that's education system or transportation or how the housing patterns are set up? Like, why is it that the policy is creating these outcomes? And then getting to deeper with people about their own leadership. Like, what is it going to take inside of your agency to address kind of just not the policy, but to address the leadership is going to require to actually do the right thing. And then not only that, but how accountable are you to the outcome? So it's really kind of, and if we can begin to have those conversations with them, with the community, we do find that some people are moving, but it's, as you know, it's slow. It's slow to try to change not just the history, but people's thoughts and what they actually believe about people of color. And it's kind of what you were saying, too, about the whole snowball thing of the snow. There are some people that don't realize that you are actually cutting people off. So kind of what are the questions you're asking yourself as you're making these policies? We've actually tried to encourage people to actually, before they make a decision, can you do a health impact assessment before you make a decision? Or can you do some sort of racial assessment on how it will affect people of color when you make a decision? So we try to take all those things and in consideration. And we also try to take in consideration what Bell Hooks said, which is a lot of the experiences of our members of that integration was not necessarily a good thing for us. We lost out.
There's a mic in the back, and there's a woman that's next. So go ahead.
My question is for Isaiah. My name is Lily. I'm from the American Heart Association. I work in health equity to specifically address health disparities for Asian Americans and Pacific Islanders. So, you mentioned Asians and Hmongs as, a larger group in Minnesota. So I wanted to know, you also sort of touched on there were barriers to that and bringing them to the table. So I wanted to ask you a little bit more about that. What were the barriers, and were you successful in bringing them to the table?
Yeah. The answer to that would be no. I think that the challenge is twofold. Number one, Isaiah organizes churches. And that doesn't mean that there are Hmong churches. We haven't figured out a way of how to connect with them. That's on us. We haven't yet figured it out. Two, I'm of the mind that those churches may never come into Isaiah. That may be okay, but then what are the strong partnerships that we know strong Hmong organizers? We do. We know strong that in the community they have strong organizations. So how do we build relationships with them authentically, where it's not just come and serve our project? Right, so that the relationships we had were relationships that had been fostered over years. So now I think it's a challenge to Isaiah to say, okay, what are those relationships we want to foster in the Hmong community and in the Somali community?
So rather than talking about races and cultures one at a time, we all believe in collective impact and know that there are many challenges working across different cultural and racial groups. I wonder if, Marquise, you could talk a little bit about how Coco, being in a community that's had some transition in terms of going from black to Latino and then working across the city and other sections across races and Koreans, everybody's coming in. How are you working across races to get collective impact, have people see things, perhaps see them the same way, coming from different traditions, different experiences?
Thank you. That's a good question. One thing I didn't mention about the Community Coalition is that from the outset it's been an African American and Latino organization because the character, that's the makeup of South Los Angeles, mostly demographic, although we do have some actually Hmong sections and others. I think one of the main principles that you go to with organizing is don't ever skip having the conversation. There's no amount of study or research that you can do, all of which you should do, but none of that can replace the actual conversation. So actually talking to the Korean store owner about owning a store in a community where there's violence around his or her business, there's no replacement for that, because 9 out of 10 times you'll be surprised that lo and behold, people don't sit in South Korea and go, what I really want to do is go to the United States and have a liquor store in the middle of a violent community. It turns out that that's not what they were going for when they came here. And so helping them get to what they want can coincide with helping the community get to where they want to be as well. And I think, Los Angeles is particular in this way because we've always, the main character of all our citizens, or something that most citizens in Los Angeles have in common, is none of us are indigenous. We all came here, and the black population, unlike cities in the Midwest and in the South, even the black population wasn't brought here against their will. People came here to live out their dreams, and generally you can weave a theme and a set of goals around that, because people are in LA for very, very specific reasons, and to have a good quality of life. And you can build unity around that and build campaigns around that. And I think there's a lot of examples in this city of where that happens.
Yeah. So I'm going to answer that question in the context of working with churches. So, like I said, Isaiah is, their members are 100 congregations. Those congregations are largely like African American, white, and Latino. And then there are a bunch of kind of multiracial congregations. I would not be telling the full truth if I didn't say that the church has a problem with race. It does. As we know that during the church hour, 11 o'clock or whatever time it is, the most racialized hour probably in America. That's probably still true. So one of the things that we've been trying to do in Isaiah is that, again, if we're going to try to change the world out here, we actually have to change ourselves. And part of that is actually addressing within the church, how has the church been complicit in whiteness? How has it been, and I'm going to use some church language here, how has it been a chaplain of the empire? The church has been involved in idolatry, and it has not been serving people. It has not been nurturing to people. And so we first have to have that conversation, particularly, as I said, Isaiah wanted to work on race. So just because we were church people didn't mean we just all got along because we all had some faith. But what does it mean that you had a group of people who were white and Latino and people who were biracial too, like working together? We weren't going to just automatically do that. So we had some hard conversations about the church, about our own individual beliefs, what that had to do with our faith, in order to actually be this strong organization who could then authentically speak about integration, authentically speak about race, authentically speak about the injustices that are happening around class and race and all of that. So.
Thank you.
Hi, my name is Corinne Graffunder. I'm the Acting Associate Director for Policy at the Centers for Disease Control and Prevention in Atlanta. So thank you all for your remarks. Phyllis, actually, my question is directed to you. I really appreciate the fact that you've talked about health impact assessment as a methodology and as a tool for helping to focus on health as a part of a bigger picture, as well as then put some rigor, if you will, around the approach. And so I guess and at CDC, we've done some work and supported a range of different health impact assessments, particularly in some of our portfolio around health and all policies where we've worked with other sectors. My question for you is, do you have a particular champion, or what is it about your work that has grounded it in the health impact assessment as a tool for you moving forward? Because we don't hear as much of that coming up. We don't see as much of it. So I'd just love to know some of the backstory behind what that is that's helping drive that.
Yeah. Like I said, that part of how the conversation around the social determinants of health even showed up at Isaiah was through a leader. So you had a public health nurse that basically said, this is important, and that Isaiah can no longer have kind of these siloed way of thinking about issues. So that was number one. So then there was kind of a groundwork of people across the organization understanding that. And it took probably about like a year and a half for us to really like to seep in what we were trying to do. So that would be number one. Number two, that same individual is now the Assistant Commissioner of Health. And she has been using her community organizing skills to basically organize public health to look at this work and to view HIA as a tool that the community should use. And so, what does the partnership look like for public health and for organizing? And there's been many, and probably if Kate wants to speak more to this, there's been many efforts to organize those group of people to say, we have something in common and we should work closely in alignment together. So I would also say that, I'll just say this thing about Minnesota. Minnesota is like, I think it has the highest concentration of 501c3s, nonprofit organizations in the country. It's something ridiculous like that. So I think you have I think that mixed in with people who are, who like research. And I think, so it's that kind of mixture that kind of births this kind of influx of HIAs in Minnesota. So it's just not us. I think there have probably been upwards towards maybe 18 HIAs that have actually happened in Minnesota. So kind of a high percentage of people who are really trying to figure out how do we use this tool to advance our work.
I'll just add a little bit of background. So that's all the trajectory. And then initially what had happened was Isaiah fought for years around a $1 billion investment in transit where all the stops had been pulled out of the poor communities, and the communities with the highest amount of African American among, they lost access to the largest transit investment that was ever going to occur in Minnesota. So that was a multi-year fight to get those stops put back in. But then we had to say, what will happen to these residents now that they have a $1 billion transit line running through their neighborhood? Are they going to be able to stay? And so with this newer analysis of social determinants of health, and knowing that transit is some of the biggest contributors of gentrification and removing people from where they live, we look to health impact assessment as both a way to investigate that, but to build a counter, a table that could counter the power that was at the city with both evidence, but with a 22-member panel that represented business owners and homeowners, so that they could use the research to really change some of the conditions that were going to happen without intervention.
Sandy Magnan, and I'm from Minnesota. This has been a great conversation to be having, and there's so many layers in this. And I just wanted to share something that had happened recently to me, and then to just get your input, and had to do with the word community. So coming from the white perspective in this conversation, community was being used as more the physical social determinants of health. You know, whether there were schools there, whether there were places for jobs, whether it was a bikeable or walkable community. So it really had to do with the physical part. And it was a conversation with people of color involved in it, and we realized that we finally stopped the conversation. We said, well, how are you using the word community? And the Latino woman said, well, when I'm talking about community, it's all the Latinos in the state. I'm not talking about the physical structures or the geography that might be associated with it. And so, and there was an African-American woman there, and she said, yes, that's how I'm thinking about community. So it was just this aha moment for me, even a word such as community, how we might be seeing it differently. It's probably a both and, but it's like even knowing that, or how to unravel or peel this onion away as we talk with each other to build some commonness. So I just wondered from the panel, you know, if you've run into that same thing, or how do we keep peeling this onion away, even about something as what seems simple as the word community?
I think, you know, I think that happens all the time. Community is one of those words, kind of like organizing, actually, that has a lot of different meanings to different people. I think it's up to it's the role of the organizer to define it at the outset. Because if you don't, it's absolutely the case that people will walk into the room. People walk into the room with agendas, and then people walk into the room with particular histories, right? And so they're going to read into it, read that into it. I think one of the other dynamics that happens with the use of the term is there are, I'll use the word fads, where, and this happens with black people in particular, but it happens, I think, with a lot of different groups. So there's a time period where you can't say, we're going to go do something for black people. So black people stop saying black people, we start saying community. Right, and so that the use of that word becomes tainted, or, you know, you can't. There was a time when you can't say Latino, so you say immigrant, right? Even though, for example, in Los Angeles, there's a bunch of black immigrants, and most of the people in the United States without documentation are actually Canadian. But when I say immigrant, you don't think of Canadian. Right, because it's being in many ways it's being used instead of using race, because people, a lot of times, those of us who are on the side of fighting around these issues feel like if you use race, you will lose, right? So you figure out another word that encompasses what you mean. So I think, you know, a good leadership defines it at the outset and reinforces it throughout the process.
Ditto.
Thank you all. I'm Martha Gold. I'm on the roundtable. I guess my question is eluding me at the moment. Let me take a moment.
So I can ask a question while you're gathering your thoughts. So, what in your organizing, what is the role and relationship to what we would call traditional experts? So what's your ideal in terms of academic partners, public health partners? How do you think about those relationships, and what's your ideal partnership with people in those fields?
Well, Manuel Pastor lets me work out on USC's campus every week. So that's ideal because I'd have to pay for a gym membership otherwise. But seriously, I think, for us, there we find that there are three type of experts. There are sort of scientists who, are just looking at us in a dispassionate way as an experiment, which is generally speaking useless, and we don't like those people around us. Then there's two. There are people who will fetishize your work. And so they want to write about you, they want to be around you, but they don't necessarily have skin in the game. That's the way to say it. And then there are activist experts. And they want to sit with you through the strategy, and they want to help with the strategy, and they want to be there throughout the process. And they're willing to put their name on work that they know you're going to use to move your agenda, and they're willing to stick by their work when it becomes controversial. And for us, those are the three categories, and obviously we look for people in the third category.
The only thing that I would add to that, I'll just speak about, we did have three expert researchers to come in to share from their point of view what was going on around education and health specifically, and equity. It was very important for us that that people had in some ways dissected their own internal racialized oppression. So being an activist, could you also be a human being in the room with people? Could you actually put what your challenges on the table as well? Had you thought through how you actually communicate with communities of color? I can honestly say that there was one person that was a part of this, one of the three, who we had to have a conversation beforehand before he entered the room about some of the things that in some ways he was not allowed to say, and some of the things where it was like, let's talk about it. So, and that's because he had a kind of a history of rubbing communities of color the wrong way. I think that he has some sort of personality probably disorder around being able to read people when he's talking that he doesn't understand. But so it's very important for us that experts that come in the room are relatable with people of color and that are relational. So yeah.
I think the other thing with experts is I think it's real important we really look for, as a way to assess these categories, we really look for a read on people's values.
Yes.
Right?
Absolutely.
So, which is obviously you can't have somebody walk in the room and say, what are your values? But you get a sense of people's values by, tell me your story, right? And the parts of the story that they emphasize tell you a lot about what's important to them. Right. So, if you just take elected officials or professors or, healthcare professionals, some people are doing it because they feel it's their life calling. Other people are there, they're very clear, people sacrifice so I could be a professor. So what's useful to me, or the reason I'm here, is to help other people make that leap. And so that gives you a real clear idea of where people are coming from. There are other people who say, I have this great idea and I know it's right and I'm going to keep studying till it's right. And it might be a great idea, but that's largely about them and the idea. And it's not about us. And so you over time, you begin to notice these you begin to notice these tendencies amongst people, and it helps you pick out what kind of product and what type of working relationship you'll have.
So I'm going to try again. This is really going to Phyllis Hill, and I want to go back to what Corinne was talking about in terms of the health impact assessment. You know, one of the things the Roundtable is trying to accomplish is to give people a larger understanding of what creates the health of populations. And we certainly have been wanting to engage the Education Committee, and our next Roundtable is actually with the education folks. When you make a decision to sort of present a sort of political issue and you frame it around health, did you think that was particularly helpful to you? I mean, you could have framed your issues around education and said, this is what would happen if we had a sort of a more meaningful integration and there was a better education. But you took the approach of going through health, and I wondered if you thought that buttressed your argument in a significant way.
Well, it's just several things. Number one, using a health frame, particularly using the HIA tool, basically began to legitimize what we were saying. So it became like this credible research moving forward, and it actually, it was kind of language that legislators could speak to. Or so the dialogue was opened up a little bit more because we had this research. And that we were looking at it through a health frame. So again, to talk about Representative Carlos Mariani, I mean, that was the fight he was in. It's like, how does this pot of money and this pot of money and this pot of money, add up to the wholeness of the child and to families? So he definitely appreciated the health frame. And so how do we use the health frame to get people out of their siloed way of thinking? Particularly as a child enters into the classroom with not just, a need just to learn, but also particularly a lot of communities of color. And if you're talking about out in greater Minnesota, you're talking about white people and you're talking about Native Americans, they're coming to school hungry, right? And a lot of them are homeless. Some people are going through a foreclosure situation. So there are a variety of things that we wanted to be able to look at. So it wasn't just about, again, what was happening inside the classroom, but it was the factors of what is happening to that child when they come into the classroom. Like, what is happening to them at home or at the shelter? Why are they there? And so we just found that the health framework really kind of spoke to our values that we really wanted to address, and actually widening the conversation beyond just that classroom.
I think we're at time. I'm looking for Mary Lou. Okay, yes. So lunch is here. So let's thank our panelists again and thank all of you for your questions.